So,
All right, I'm gonna let folks in. You ready?
yep. Am I muted? No, good. Hi, Michelle. Thanks for joining.
Hey, Josephine, Sister Josephine's on.
Dr. Williams. Dr. Fuller from North Carolina. All right.
Mhm.
We got a lot of states repping today.
I know. I'm like, look at all the states.
This ain't a DMV thing.
Texas in the house.
Ghost, baby.
Carolina,
Ghost.
Georgia, Cali,
Be more in the building.
ACT, Dr. Son Goodman. Connecticut's here.
Okay. Representing Stacy's folks. Okay, okay. All right.
Okay, Billy. Okay, sorry.
Shall we get started?
Yeah, I think it's a good time to start on.
All right, Dr. Bentil. Okay, so everyone, welcome to Doc's Global Affairs Info Session as we are hitting the road to Accra, Ghana. This is super exciting for us because Global Affairs pretty much launched this year and we're already going to start our very first event. So we are getting the ball rolling, y'all. We are not playing, okay? And so I can introduce myself. I am Dr. Anyi Atabong. I am one of the co-chairs for Global Affairs for DNPs of Color. I am a psychiatric and family nurse practitioner based out of Maryland. I'm also adjunct faculty at Coppin State University. Dr. Bentil, want to introduce yourself?
Sure. I am Dr. Stacy Bentil. I am been with DMPs of Color, I think, Danny, from the beginning. What are we at? How many years are we in now? From the start. Been in the trenches with Dr. McCamey for a while, and I just love everything she's doing. And it's just so inspiring. So I'm definitely happy to have everybody here. I am out of the state of Connecticut, one of the nurse executives for the state in the Department of Children and Families Division. I'm also adjunct faculty at Central Connecticut State University and also on the NYU Alumni Executive Board of Directors. So welcome, everyone.
Yes.
And of course, I am also a member of GDNA's executive committee leading the leadership division. So I'm just feeling all the love, as I said, with both of these exciting, inspiring committees. And welcome, everyone. Let's go.
Yes. Thank you, Dr. Bentil. So one of our charges, real quick, Dr. McCamey, I just wanted to hit on our charge. And that, we're expanding on the mission for DMPs of color by inspiring global curiosity, understanding and engagement by creating transformative opportunities for members through their own lens to make this an international experience for you. So this is going to be an amazing experience to where not only do you get to go to Ghana and have a good time, but you also get the opportunity to be of impact working alongside other nurses across the continent, which kind of delves right into our vision of inspiring, empowering, and transforming the landscape of nursing by also increasing diversity in doctoral nursing practice. On the continent currently, the DNP degree does not exist. And so with partnerships and collaborations with organizations like the Ghanaian Diaspora Nursing Alliance and other academic institutions, this will definitely create more visibility and awareness to the continent for them to understand the importance of having advanced nursing degrees. Our mission is to serve DNPs of color through networking, like we're doing today, mentorship, and advocating to increase diversity in doctoral studies through clinical practice and leadership. Dr. Idun.
Hi, everyone. So my name is Dr. Jacqueline Idun. I'm a family nurse practitioner. I live in California, and I'm also the Director of Communications and International Affairs at the Ghanaian Diaspora Nursing Alliance. I'm excited that you're all coming to Ghana, though. I'm going to assume all 26 of us here are going to Ghana, so.
Yes, yes, definitely an exciting time.
All right. All right. So the Ghanaian Diaspora Nursing Alliance was founded by actually Dr. Commodore Mensah and Dr. Decker. They're both on here. Both faculties at Hopkins, they just ran into each other, and the rest is, it's like a love story. It just happened. They're both from Ghana, so it was like, let's do something because we both have Ghana in our DNA. So GDNA, I don't know if y'all saw what I did over there. But basically, we're hoping to link Ghanaian nurses in the diaspora and also in Ghana. So we have a broad mission, but we'll get there. So our vision is to foster a sustainable, sorry, that's my mission. I was jumping ahead. So our vision is to significantly contribute to Ghana's ability to produce global nurses who are skilled and knowledgeable in specialty nursing areas. So when I talk about specialty, I'm talking about like critical care nursing, nurse practitioners, mental health nursing. So it's not something that's really big over there. So we're trying to contribute significantly to that. And then our mission is to foster sustainable local global collaboration. So kind of what we're doing here with DMPs of color between Ghanaian nurses and in Ghana and in the diaspora to advance nursing education in Ghana and also to improve the health outcomes of Ghanaian people overall.
Thanks, Dr. Idun.
Thank you.
So here we unite, DNPs of color and GDNA. We'll have a conference January 3rd to the 5th of 2025. And our goal is to promote partnership, which aligns our mission and vision for international nursing excellence. So this is why we're having this info session. So we're going to talk a little bit about Ghana, the expectations, and just how to prepare for this trip. Our overall partnership goals, pretty much the, we'll skip this one, Dr. McCamey. So our overall objectives and goals for the conference is to enhance nursing education. We want to be able to highlight the importance of doctorally prepared nurses. We want to promote academic advancement. Dr. McCamey, there we go, perfect. We want to be able to promote academic advancement. We all know the importance of being able to keep ourselves astute in our skills and increasing nursing education definitely across the lifespan and internationally. We also want to be able to offer support. So that's what DOCS is doing. We are partnering with GDNA, giving them our hand, extending our leg to offer support and supporting their initiatives in Ghana. We want to build relationships. This is what we're doing. So hopefully we are going to have future events. We want to promote best practices for not just us, but for our nurses that are on the continent. As we all know, a lot of us now are traveling to Africa. And so I'm sure most of you would like to be able to be comfortable enough to walk into a clinic if you got a boo-boo or a headache. And so you want your providers to be knowledgeable, confident, and competent. And so, doing partnerships like this is what's going to help advance that. We want to be able to sustain partnerships. And of course, we are aligning our mission and vision with organizations such as GDNA so that we can be a bigger impact and to be a force, not just here, but on the continent as well.
Right. Now let's prepare for this amazing trip we're about to have in Ghana. We can't wait to see all the attractions. We can't wait to land. I think when you get to Ghana and go to Ghana, as soon as you land at Kotoka Airport, you feel the impact. Like, oh, it just feels like you're home. So with Ghana, it's definitely the motherland. We say Akwaba because it means welcome home. And they are full of attractions. Not alone are you going to be meeting amazing people of the country, but they have attractions. So Accra is the capital of Ghana on the Atlantic coast. I won't go through all the history, but we're able to see the National Museum of Ghana, which is one of the oldest of the 6 museums that they have there. We'll see the Kwame Nkrumah, who was a pioneer of Ghana and all the work that he's done. We'll actually go to Cape Coast Castle as well, and we'll see a lot of the slave castles. That's going to be a very impactful piece of the journey that we have that while we're in Ghana, and really get down to the roots and really see the journey that our ancestors take. It's very empowering, but I must forewarn, you really feel a little bit angry sometimes, like I can't believe this happened to all our people, and it really is very impactful, and you leave pretty stunned, but it's such an amazing thing to at least go visit at least once, and you'll definitely be checking it off the bucket list. So the healthcare system in Ghana, as Anyi and Jacqueline stressed that, we definitely have some improvements in the country, and that's what a lot of the initiatives that GDNA is doing to really uplift the country and most importantly, the healthcare system. So it's organized in 3 different levels. They have the national level, the regional, and the district level. They also have 5 level of providers, which is the health post. They have health clinics, hospitals. The hospitals have the districts, regionals, and the territory areas as well. There's urban areas for the well-served, so you will see some of the wealthy, and then you'll also see the rural areas that have some traditional practices. You'll see herbal medicine. You'll see some of the herbalists as well that practice the herbal medicine as well, and they are very engaged, and they would love to talk and educate us on how they practice as well. And most healthcare is provided by the government. It's very government ran and very political in Ghana, and it's largely administered by the Ministry of Health and the Ghana Health Services. I'm trying to advance. Let's see. All right. So, international travel preparation, visas. So let's get into visas for a little bit. All U.S. citizens need to obtain a visa to enter Ghana and can apply for the emergency entry visa through EEV, also known as our visa on arrival. You can also use travel document service to help you prepare your trip, but definitely don't wait to the last minute, like some people do, to get that passport. They've changed a lot of the rules to get your passport up to date, get visas up to date. They do have fees, but I know there are some people who either have expired passports and visas that they noticed last minute, and it's not the next day ready like it used to be when you can run and just get it next day. I think Annie experienced that recently traveling. But they did change a lot of the rules and regulations in the United States, even for traveling to other countries as well as Ghana. So please don't wait till last minute to obtain the visas. Here's some of the costs for the single entries and the multi-entries as well. But definitely double check your passports as well to make sure they're nice and up to date. And don't forget though, at home.
And Dr. Bentil, just to jump in real quick, for individuals trying to figure out where to apply, we've sent the link in the chat, so just pay attention to that so you know where to apply for your visa.
Absolutely.
The Ghana Embassy, yep, GhanaEmbassyDC.org.
Then we have vaccinations. We have a nice QR code here for everyone. So vaccines are recommended or required for Ghana. The CDC and WHO recommend that following vaccinations for Ghana be applied: typhoid, hepatitis A, polio, yellow fever is what I usually always get, rabies and hepatitis B, meningitis, flu vaccine, influenza, if you have that, COVID, pneumonia, chickenpox, shingles, Tdap, measles, mumps, and rubella are the recommendations from CDC and WHO. If you're up to date on your immunizations, this will be a great way for you to go back and just double check you have everything that you need before traveling.
That yellow fever.
Yellow fever, yeah.
I was gonna say yellow fever, everyone, make sure you get that one because they will ask for that on arrival. I was embarrassed. I was, well, yes, and if you are not entering without it, so make sure you highlight yellow fever.
Yeah, and they usually give you a yellow card too to
Yep.
say to go with it. So it really outstands, and you can show your yellow card if they ask for it for your yellow fever vaccine. Passport Health is a great go-to place. They definitely are one of the bigger organizations for international travel. So we definitely recommend going through Passport Health. We have a QR code here as well. Reminders is just to protect yourself from bug bites by wearing long clothing, using CDC recommended repellents like avoid bug-prone areas during peak hours, reduce the risk, safeguard your health while abroad. Always get cooked food, hot foods. Always drink out of water bottles and not usually the street food or street water bottles that are not really labeled as well. Look for the labeling as well. Sealed drinks, hand hygiene. Nurses, we all know the hand hygiene. In fact, practicing infection control brings it all down, brings it all back. Limit our exposure to risky local dishes, of course. It will be tempting. You will say, that smells good, or let me just get a bite. But just be mindful of these things as well. To prevent travelers from diarrhea, maintain these precautions, eat carefully, prepare foods, avoid untreated water, sanitize your hands, consider probiotics, and exercise caution with unfamiliar cuisine. We will be walking a lot as well, so you will be seeing a lot of the street food. Just be mindful of what you're eating. All right.
Right. So your travel arrangements, we were able to identify 2 travel agents that are willing to assist and work with you to prepare for flights and accommodations. Unfortunately, we couldn't do a big group travel because everyone is coming from different cities, so it got a little difficult. However, they are willing to work with you by preparing flights and hotel. Now, for those of you that don't want to do this, perfectly fine. You have the option still of going to Airbnb, which is what I have done the last 3 times. And booking flights, I use Google Flights just to kind of keep an eye on the prices. And right now it's getting expensive. We are in September, so the prices are going up. The sooner you purchase your ticket, the better. Skyscanner is another great website for you to use for cheap prices. Make sure you purchase insurance on your flights. Please make sure for any cancellations, and luggage issues in case that happens. Knock on wood, it doesn't. But again, you can reach out to Miss Hilda or Mr. Kingsley for assistance.
All right. So I know you mentioned a little bit about the flights, but also January might not be as bad because a lot of people tend to go to Ghana for Christmas because there's a lot happening almost like every day of Christmas. So if you do want to partake in the events happening December, then yes, please buy your ticket as soon as possible. But if you're looking to just come for the conference and the doc and DNA events, then you should be able to find something reasonable in January. And flights are expensive, but otherwise, I think food should be pretty affordable. Accommodation, depending on if you're trying to, be bougie or not. that might be expensive. You're trying to be bougie, but if you're not, I think you should find something reasonable. It mostly just boils down to the flight. So, all right. So this coming Saturday, we're having a fundraising gala at the Embassy of Ghana in Washington, D.C. So if you're in the DMV area or even in New York, and you, or not just New York, Connecticut, like Dr. Bentil, Connecticut or Jersey, and you can make the drive down there. It's for a worthy cause. We're raising funds for nurses from the rural areas in Ghana who are finishing their specialty nursing education. So what happens in Ghana is when you're done with your nursing training, the government kind of posts you into these communities to go serve. It's kind of like a national service, they call it. So they post people in the rural areas, but they don't like to stay. So if I'm from the city and I get posted in the rural area, chances are I'm just there to satisfy my time and I'm right out. So what we're trying to do is to help the nurses that are from the rural areas, because we know they will go back home. They have families there. They love being in their homes. So if we can support them finish their specialty nursing training, we know that at least the people are getting quality care because there won't be physicians, but we all know nurses are capable of doing what the physicians are doing. So that's our goal for the fundraiser, to raise funds to support the nursing education. Last year we were, well, not last year, this year in January, we had a fundraising gala in Ghana and we were able to raise some funds to support 9 students. So if we can get this ball rolling, we can support more people in the rural areas, which would be great. So if you can make it, please, we'll be happy to see you there. And next slide. Okay, so for the conference in January in 2025, we do have multiple tracks, and one of them is research and evidence-based practice. So we are right now accepting abstracts, I think, till September 30th. So if you've done any work that you would want to present, if you even have just an abstract or an idea that you can put into an abstract, please send it our way. Would love to hear what you have working on. Would love to have the Ghanaians, the nurses in Ghana, see what you've worked on, what you're working on. And you never know, it might spark something in them that would also make them want to do some research or start something. So if you have anything that you can submit, please don't hesitate to submit. Next, please. All right, so I know we've talked a lot about the conference, but we're really hoping that you all show up. Let's see, all 27 of us now are going to be at the conference. Last year we had well, I keep saying last year, this year, January 2024, we had a conference on reimagining nursing education in Ghana through leadership, management, research, clinical practice. And it was really good experience. We had an organization sponsor, like about 15 nurses from the north to attend. So we had nurses from all over Ghana over there, and it was very impactful. We had like sessions for CPR. We had research EBP sessions. We had mini breakout sessions to talk about advanced practice nursing, because it's one of the things GDNA is personally trying to get the health system in Ghana to adopt. So we had sessions on that, sessions on migration into high income countries. And then we also had Dr. Cinder from Hopkins come talk about resilience, which was a great topic because the nurses in Ghana, they go through a lot. It's a lot of hierarchy in the healthcare system in Ghana. So having her there to talk about resilience and all was really good. We were also able to teach the nurses CPR. It's something that sounds very easy because we do it here, but in Ghana, it's not like that. So we were able to have them do like hands-on CPR training. We partnered with AHA and they were able to help with that. So that worked out great and they loved it. So I'm sure they're looking forward to coming this year, and having you guys there would be I can't even imagine how impactful this is going to be, because this is literally linking the global and the local collaboration. So I'm excited for that. One thing that we haven't talked about is a health fair. So what we've been doing with our annual conferences is a health fair. So this year we had a health fair in Brenu, which is like one of the rural areas in Cape Coast, which is where all the slave trade action happened. It's a very rural community. We partnered with 4 other organizations, and I think we saw a little, maybe close to 400 people from the community. We pretty much provided care. We did screenings, had medications that will last them for over a month, because we can't just prescribe and diagnose and not prescribe. So we had medications to sustain them until they were able to go see a provider. We also had wound care sessions. We also taught the local people how to do CPR. So it's like, even though you didn't go to high school, if you were to see someone passed out, what can you do? How can you help this person? And we were able to do women's health screening as well, which is really great. We got to connect with they have something in I think I want to say the Global South called Community Health Providers Centers. I'm not sure if you guys are familiar with that. It would be like the district community, do we have them again here? I feel like the local clinics by the district. So they have that in Ghana now. It's something who was traveling. So we were able to connect with the one midwife there who works with like 20, 25 patients daily. So we're having a health fair this year too. So if you want to stay extra after the conference, I think it's just like 3 days after the conference, that would be great. But let me get right into this year's conference. So this year's conference, we would have, like I said, different breakout sessions. We are still going to do the CPR class because a lot of the Ghanaians like that. We're doing a suturing workshop for the midwives. If you're not familiar with Africa, they separate nursing from midwifery. It's not one thing. So we will be doing a suturing class, a perineal suturing class for the midwives, because last year they felt a little bit left out. And this year already, we've already done a workshop for them. So we're hoping to be able to continue that. We'll also have a roundtable on the advanced practice nursing. And also we're hoping to have a session on Muse, which is kind of like SBAR, in addition to knowing signs to alert a physician if a patient is declining. We're also having an innovation and hackathon, which I'm so excited about. I think it's going to be very new to the Guinean nurses, but we're very excited to introduce that. And then we'll have the evidence-based practice and the research workshop. So those are some of the tracks we have right now for the upcoming conference. And again, we will be having a health fair, but this time in the Volta region. So we're not going central, we're going to a different part of Ghana. It's where we have our local dam. Basically, the dam supplies electricity for all of Ghana. So there are some great things to do. I think it also has the highest mountain in Ghana. So if you can stay a few days later and go with us, please consider it. It'll be a great way to do some medical missions, actually work with people in the rural areas, like we're hoping to do some data collection as well, so we can actually publish these things happening and keep track of what's happening. So I think next slide. The health fair is January 9th. But yeah. So like I said, I'm hoping to see all 27 of us in Ghana. It's a great place, and honestly, I really hope you can all come.
Thank you, Jackie. And
Thank
I
you.
think we definitely want to take the time to thank Dr. Danielle McCamey, Dr. Matilda Decker, Dr. Iban Kumadri Mensah as well for giving us this opportunity to bring these two organizations together. It's just amazing. I know the work going forward is just going to be a tremendous amount of growth as we embark on different countries. But guess what, y'all? Ghana, here we come first. So it's definitely an exciting time. We're going to have an amazing time. We're going to make impact. We're going to influence, and we're going to have a little good time for ourselves as well. So please, if you can join us, any questions for us, we're here to answer. But we're looking forward to seeing everybody.
Yes, thank you.
All right, let's see if we have any questions in the chat. Okay. I don't see too
Yeah, I don't see any.
many. Okay, let's
Or any concerns?
Yeah, I was like, DMP family, any questions, any thoughts, any concerns?
I think we have one, wondering how active this group is among nurses in other countries beyond the US. Okay, so I think we've addressed that one, as we're definitely going to be going international. Ghana's our first stop, but we are definitely looking to partner and do more influential work in other countries as well. That is definitely the goal for the Global Affairs Committee. Yvonne says our Canada chapter is growing. So we definitely will definitely be looking to partner and have some mission work and collaborations with Canada as well. Thanks, Yvonne. How will we all docs?
Chapter 2, sorry. I was saying we have a UK chapter 2, so if anyone's in the England area.
Yeah, Dr. Callie Brown she's very excited about the opportunity. How will we all docs meet up once they arrive to Ghana? So
That's a great question. I believe there would be an opportunity for us to do that once we can figure out who's coming. So I believe what would be a good idea is for those that are confirmed, if you could email globalaffairs@dmpsofcolor.org to confirm you're coming. And so we can keep a head count, and then we can definitely arrange for us to all meet up during that period once we know, your itinerary.
Yvonne also added that there was a room block for us as well, this chapter. So we will definitely have time at Labadi Beach at the conference. Since we have a room block, we'll probably engage and meet up there as well.
But Accra is quite big. I would like to have some time outside of Labadi,
We're gonna have a time.
Have a time, okay.
We're gonna get Dr. McCamey to get loose in Ghana.
Okay.
We're gonna get her loose. What are y'all doing?
Listen.
That's my mission.
I see Dr. Janet Williams shaking her head like,
Yes. It's gonna be an amazing time. We're gonna have a good time. We're gonna vibe with the people. It's still kind of holiday time, so it's gonna be just tremendous amount of events. Probably take some time to see some schools, see the beautiful children, and we're gonna have an amazing time. So we won't be bored, tell you that much. And we'll be outside of Labadi, as Annie said.
You can't be bored in Ghana.
No, doesn't exist. Doesn't exist. Okay, I'm new to doc and I'm able to come 25. Oh yes, we'll definitely be keeping everybody updated for 2026 as well. The continuous planning, continuous engagements with other countries, and more to come with that for sure.